Hi guys, so this is another video to answer some questions about my TMJ joint replacement and discectomy with fat graft. In other videos I have answered about time off that you may need, pain medication, anxiety before the surgery, about TMJ itself. This one is about the actual procedure. So for me, I was waiting 2 years for this procedure after failed arthroscopy and arthrocentesis. When I went to the hospital, I arrived, they checked me in, they put me in my gown, did my questions. They had a ton of nurses around me to ask me many questions. I was very anxious. I was about to have a panic attack and I was in tears, so they gave me some anti-anxiety medication which calmed me. When they took me into the theatre operating room, it was quite quick. They put me to sleep and that was fine. I woke up in ICU, so I had to go to ICU for the night, where I was managed quite well. It was pretty amazing actually how well it was taken care of. I don't really remember a lot of it. I was quite out of it at that point. But I remember being very swollen, but it did increase. So after one night I was moved over into the hospital ward, where I shared a ward with 2 other people. So that was, thought it'd be challenging, but it wasn't. I was taken good care of. I then started to swell. So at about day 3, I was massive. I do have lots of photos of them. I just haven't shown them yet because I'm not sure who wants to see it, because I don't want to scare you. You want to see more longer term things, I think. But I started to swell. I remember a day 2, day 3, not sleeping, up in tears at night. It wasn't easy. It was very difficult, but it got better. Day 4, it started to get a bit better. Day 5, it got a bit better, that they said I could go home. And I went home at day 5. And yeah, I was taken great care of. I went home with medication, and day 5 to day 7 was quite hard at home, but I was well prepared. I took it easy, and by day 7 I started to see more improvement. So I did start these YouTube videos at day 10, so that will give you an idea of how I went from feeling a lot of pain in the hospital, but managed. You tell them if you're in pain, they would just take care of it, and communicate that. So the procedure was pretty good. Complications, I think, is one of the main questions as well, and worries. I still do have a paralyzed eyebrow. So my joint replacement here, I will do the raise. I only raise one, and I can close this eyelid. Doesn't close completely, which should take about 4 weeks. Complications is, I've spoken to my surgeon today. I have what he likes to call first bite syndrome, where I get major shocks of pain, very pain up my face on the joint replacement side, when I have a first drink of this, a cold drink, or a first bit of bite of food. So taking that easy, you know, really taking that easy. I got home straight away actually after surgery. I was on a soft chew diet. I didn't need the syringes that I had bought. I bought many big syringes to like squirt, but I wasn't banded, I wasn't wide shut, so I can't relate in that sense. I just had a baby spoon, and I still use a baby toothbrush. So it's just watching how much you put in, and being very mindful of those muscles there. So yeah, that's about the surgery. If you have anything else, feel free to ask.